Hello and welcome to my YouTube channel. I hope you've been able to watch a number of the previous videos. Today I'll be focusing on myositis. An easy way to remember this is if you hear the word myo, it means muscle, and if you hear the word itis, it means inflammation. So if you put the two together, it means inflammation of the muscle. That's myositis. I'm just going to mention from the get-go that there are different types of myositis, but two I'm going to mention here will be one, polymyositis, and then dermatomyositis. Polymyositis, remember, if you've watched the video on polymyalgia rheumatica, poly means many. So if you say polymyositis, it means inflammation of many muscles. And then if you say dermatomyositis, it means myositis in addition to skin involvement. If you hear the word derma in medicine, it means skin. So dermatomyositis would be polymyositis plus skin involvement. So in summary, myositis means inflammation of the muscle. Polymyositis means inflammation of many muscles. Dermatomyositis means inflammation of many muscles plus skin involvement. Essentially, when we say there's inflammation of the muscles, it means that the muscles become weak. Sometimes there's some pain, but usually more of weakness than pain. And the muscles that are typically involved will be muscles of the shoulder, muscles of the thighs, and there are a few things that will happen that will make you clearly see that there's a problem. I'll use the acronym that's usually used, which is hairs, stairs, and chairs. Hairs, stairs, and chairs. Hairs, because you need to lift. If you're going to comb your hair, your hands will need to be lifted up. For these patients, they find it difficult to lift their hands to even comb their hair, so we say hairs. Another thing that could happen is that if you have a cupboard or a shelf in the kitchen, you will find it difficult to raise your hands above your head to collect whatever is in the shelf. So we say hairs, and then chairs. As I'm making this video, I'm sat on a chair, and I could stand up from this chair without holding on to any surface. So if you ask these patients to stand without holding, without support, they'll be unable to do that. I know that may sound a little bit difficult for you to believe, but it does happen. Patient will be unable to get up from the chair. So we say hairs, chairs, and then another thing that happens is stairs. They will find it very difficult, if not impossible, to climb the stairs. So if you have a patient that has this condition, symptoms I've mentioned, unable to comb the hairs, unable to stand up from a seated position, chairs, unable to climb the stairs, then consider the possibility of polymyositis. And if there is, in addition to this, skin involvement happening around the eyes or any other part of the skin, please consider the possibility of dermatomyositis. Typically, the doctor would carry out some tests. Some are muscle specific, such as creatinine kinase, to see whether there's a breakdown of the muscles or because of the inflammation of the muscles. They will have inflammatory markers and some serological tests that are specific to diagnose muscle problems. The doctor to see in this condition will be a rheumatologist, and if there's skin involvement, there will be need to also see a dermatologist. There are medications that can be used to address this condition. It's however important that you see a doctor as soon as possible. If you've learned something today, please subscribe and share before you shut down. Thank you, and see you again.